everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching that earwax removal video today. You can see this patient's come through with this very big piece of wax that's actually physically stuck to the eardrum, and lots of wax in this very thin layer all the way around the outside of the ear canal as well. Now, the reason the wax is formed like this, the patient initially had quite a big wax blockage in the ear canal and was using a peroxide-based drop, which then liquefies the wax, but it then felt they could hear a little bit better, so stopped using it, and it forms then this very thin, smooth, shiny plate of wax that you can see here. So what I'm using first of all is the standard size Zollner tube. Always a little bit more of a tricky one to remove this one, just because you're working very, very close to the ear canal wall. So what's happened is where it's liquefied, it's formed this very thin layer, and you've got to gently lift this up. The difficulty is the layer usually turns out to be really, really brittle. So when you start to lift it, it breaks little pieces off, which is what you can see happening here. You can also see a little bit of dry skin getting pulled off the canal wall here as well. Now, that is also not uncommon following the use of either a bicarbonate or a peroxide-based drop, just because they're alkaline and your ear canal is naturally slightly acidic. So it tends to sort of aggravate and irritate the skin sometimes, and you can get these long, you can see this one here is a particularly long one. You can get these long sort of strips forming inside the ear canal of dead skin that we need to take away. So what I'm doing here is just very gently teasing all of this off the ear canal wall, just to try and loosen this up a little bit. You can see how brittle these plates are. As I'm lifting, what I'm hoping would normally happen is it would peel all the way down the ear canal. But as we can see here where we've lifted this up, we're going to pop the crocodile forceps on this now in a second. As we get a grip here, you'll see it just shears off that little piece. There we go. As we start to pull this away, you can see it just shears that away rather than sliding it out of the ear canal. The reason being is it's firmly attached all the way along. So unless you can lift the entire piece along the canal wall, you're always going to get these little tiny bits that are coming away here. Thank you so much, guys, for bearing with us. It is it's just insanely busy here in clinic at the moment, and Peter, our lovely audiologist who's based in our Cardiff clinic, is retiring as well this week, which means it's going to get even busier again. So I promise we will try and get as many videos out as we possibly can, guys, but we are finding a little bit of a struggle at the moment to find the time to do it. So I will get them out as quickly as I can and as often as I can for you, but please just keep bearing with us. I know we keep saying this to you, but it's really difficult to try and get everything done at the moment, but we are, I promise you, we're still trying. So you can see this last little bit here. It's very, very deep. Now we've got to remove this section before we can take that piece off the eardrum itself, because the two are interconnected, which is why the patient was still having a little bit of hearing difficulty. If you imagine you've got the piece running along the bottom of the canal, that bit then jutting off it and coming up over the eardrum and actually stuck to the drum. So it's stuck in two places. So it can really restrict the movement to the eardrum sometimes. But we're getting a really good peel here. If you guys watch the channel quite regularly, you know that peels are one of my favorite things to do. I really enjoy a good a good wax or skin peel, and especially when it goes over the eardrum as well. It's always one of my favorite things. So you can see we're right down now into the recess, in the anterior recess here. It's really difficult because this piece of wax has gone over the recess and up the ear canal. I've had to drop back a little bit. You can see just how thin that little plate of wax is there, and the reason I'm sticking with the standard size on the tube at the moment rather than flicking over to using a fine end is just because I want to get that good suction grip. Because it's really brittle, as soon as you lift with a fine end, it's at such a small aperture there that it blocks instantly, because your little bit will break away and block it up. Whereas you've got the standard size Zollner tube in there, you're more likely to get this good lift and hold on to it, which is exactly what you can see us doing here. So it's just trying to get those pieces away from that recess. It's always difficult when they're this brittle, because you lift and you're really hoping that the whole thing is going to come out in one lovely big piece. But as you can see here, it's kind of pulling away from the side of the canal wall here. It's pulled across there and just in front of the eardrum, but it's still snapping these tiny little bits. So you can see I'm trying to tease this piece out of the ear, out of that recess there. We've got a good grip on it. You can see just how chunky some of these pieces are. You know, they're not small strips either. They're quite deep. You can see a couple of little hairs embedded in that one as well. So we're just going to see if we can lift this last little bit here from the recess. There we go. Now we can see that piece now that's stuck to the eardrum a lot more clearly. We can see it's detached from the base. It looks like it's still attached here on that right-hand side. So it's all still attached there. So let's try and do a little bit of a peel. Watch this though. You can see how thin that layer is. And it's so difficult to just grip the layer without touching the canal wall. That's so hard not to do there. There we are, and we're just pulling that away. Nice big peel from the top of that in the attic there. All come away really, really well. The reason we don't want to dig into the canal wall, if you've never watched one of these videos before, is it's really, really sensitive, especially this deep in the ear canal. If you pushed that and prodded it into the skin of the canal wall, it would really feel like a scraping or scratching sensation, which is quite uncomfortable for some patients. So we're just peeling this away. There we go. Let's see if we can get a better grip now. Hold on to it. We run out of room there. We have to kind of pull across enough to detach it and then draw it forwards without crashing into the opposing canal wall there. So let's get on this last little bit here. It looks quite firmly attached. Don't forget, this is the part of the eardrum. This is the pars tensa. This is the bit that does a lot more of the vibration passing the sound through. Look at that! It leapt off the eardrum practically, flung itself at the suction tube. So we got a good grip on there. That came away really, really nicely. I was really worried that was going to be a really tough old peel to do. We've got this last little bit now stuck to the left-hand side. Let's start peeling. This is probably going to be one of the most awkward pieces to do. As we start lifting here, there we are. Sometimes I will leave a little bit of wax just attached to the end of the suction. It does tend to stick to the layer underneath and helps to pull across a little bit, but it's coming away really well, nearly. There we are. It's all starting to peel away. Now this is when it becomes awkward, because as you start to peel this away, now you've ended up, if you imagine it's flat against the canal wall like this, you've got a grip on the side and lifted it. So what we've ended up with now is this really thin piece. Well, the suction tube is not going to get a really good grip there. So sometimes what we have to do is kind of, it'll flick back into place, and then we have to kind of re-peel it again almost. There we go. As this starts to peel away, I don't have deja vu. I've just seen this bit. I'm not too sure. I may well have made a slight mistake in the editing, guys. So if I did, pretend you didn't see it. And then we're going to just peel this last bit. This is what I meant. Sorry, I think I did. So you can see as we try and get the suction tube on this now, it's not quite gripping that edge. So we're just going to try and tease this across. I've got to get it across enough that either I can get the crocodile forceps out on there and to sort of clamp on to that edge. But you can see how I'm to kind of peel, and it wants to get back to where it was, and you peel another bit and it tries to go back again. So sometimes if you've got to switch between tools, it's a kind of race. You've got to peel it and then quickly race to change tools to get in there before it sits back down and reattaches again. But it's coming away really nicely. We're just trying to get that grip on the bottom section. It's slightly wider. There we go. Out that comes. All the way down the ear canal. There we go. And we'll take a look behind that now. There we are, eardrum looking a lot better. You know, all that wax has gone there. I could have bunched that up a little bit. But you can see, I reckon if we squished that together, that's more like 3.5 centimeters than the 4 you can see there, guys. But yeah, lots of very, very thin little pieces. I'd say probably about 1.25 inches thereabouts. Lots of tiny little bits there. Well, guys, I hope you enjoyed that video as much as I did voicing it over. Thank you again for bearing with us over this really busy time for us at the moment. But as always, guys, take care of yourselves. Take care of your ears and take care of one another, and I shall see you again real soon. Bye everyone.